Hi everyone, thank you for coming to my presentation. Sorry for the small room, but as you know, it's been a crazy night, and so we lost our conference room that we had booked. But if everyone can see, I will give you my presentation. This is about reducing pain in the pediatric population and ways that we can help do it and why it's important to. So we all know this face very well. Alright, so kids come to the ER when they're hurt or not feeling well. Then we add to that by performing procedures that are often painful. Children are not just small adults, and they think differently and they process differently than adults do. So it's hard to explain to a 7-year-old why we have to do something painful in order to make them better. So why does managing pain in the pediatric population matter? If we don't manage pain, it creates more fear of medical procedures and of doctors and nurses in general. Long-term physical and psychological effects can actually occur, which most people don't realize, and pain in pediatric population actually decreases parent satisfaction. Alright, so why should we worry about controlling pain? We know that painful procedures are temporary, and it's just to help make them better, but kids don't understand that. Pain felt during medical procedures creates unnecessary fear and anxiety in children. We all see them come in kicking and screaming before they have even talked to us, long before we even approach them. Sometimes it's even difficult to get accurate vital signs on them because they're freaking out so badly. There has been proof that even short-term pain in pediatric kids, even as young as infants, can lead to long-term physical and psychological effects and can actually lower their long-term tolerance for pain. So these are just a few of the medical procedures that we perform here that scare kids and cause them pain. Things as simple as doing a blood pressure on a child. They don't understand why it's squeezing, why it has to hurt, why it's so tight. There aren't a ton of ways to relieve that one, but for everything else, IVs, shots, laceration repairs, catheters, there are things we can do to help them with the pain. Painful procedures have to be done in order to help them, but it doesn't mean we can't use tools that are at our disposal to reduce the pain. There are several ways that we can do this. Some of them include taking the time to explain the procedure to children before they are done, topical anesthetics, sucrose solution, cold spray, and positions of comfort during the procedures. Does explaining procedures help or cause anxiety? I hear a lot of people say they don't want to take the time to explain what's going to happen because then the child starts getting anxious and it makes it worse. This is actually proven not to be the case. There's been several studies, one of which practiced with 7 to 12-year-olds. They went in and explained the procedure and then performed the procedure on teddy bears for one group and then just did the procedure on the other group. And the group that had the procedure explained to them reported significantly less pain during the procedure, whatever it was. The same study also showed that children who had previous bad IV insertion attempts, whether it was multiple or very painful ones, felt more pain on future IV attempts, even if it was just one or two. Positions of comfort are said to make a huge difference in pain. Oftentimes we lay the bed flat, we hold children down in order to do IVs just because it's the easiest way to control them. But if you think about it, being on your back, looking up at the ceiling and being restrained is scary in itself before you even do anything. Sometimes it's not possible to give them a more comfortable position, but when possible, if you can allow kids to at least sit up during the procedure or to be held by their parents, it does help relieve the pain they feel overall. Pain management for infants, we are pretty good about using the sucrose for kids, but the studies I read actually showed we're really good about it for up till about 4 months. According to studies, it's effective up until 2 years. They say it takes 2 minutes to take effect, so normally when we do IVs and things, we give it as we are doing the IVs, but studies have actually showed if you start giving it 2 minutes before the procedure, it has more of an effect on the brain than if you do it in the moment. I think the reason we think it works better in the moment is because it keeps them busy and so they don't cry, but it's not necessarily helping with pain at that point. So if we can try to give sucrose earlier, we can actually help cut down on the pain. And then the most effective pain control has proven to be a topical anesthetic for all age groups. From infants all the way up until teenagers. It's the most effective, and we don't always have time to apply it before we need to use it, but if we can make a conscious effort to try to apply it when an IV or a shot is suspected, it can drastically improve the pain that is felt. And last, parent satisfaction. So we all know that all the parents are given forms to fill out for reviews, and that sometimes the numbers are not great. Wait time is obviously one of the contributing factors, but oftentimes parents don't feel like we take the time to care about their children and that their children's pain was not addressed. So even for simple things like IVs, if parents can see the nurses going the extra mile to try to reduce pain and to take care of their child, that will help drive up ratings. No parent wants to come here and watch their child cry and scream and have 6 IVs attempted on them and have a laceration repaired while they're kicking and screaming. We know the pain doesn't last, but parents see it as very dramatic. And so to help parents and to help our raises at the end of the year, it would benefit everybody if some extra effort could be put into controlling the pain. Alright, and what can be done? We've talked about this throughout the PowerPoint, but Child Life is a resource that we already have that can be consulted to help explain the procedures to the children. LMX being applied earlier, sucrose for children and infants up till 2 years old, positions of comfort when possible, also giving children the ability to make choices when possible and let them choose between things makes them feel like they have some control, and let parents be involved. It makes everybody happy. Alright, so outcomes. We would help reduce fear in children when they're having to have medical procedures done, help prevent the possibility of long-term physical and psychological effects, and increase satisfaction rates, which, most importantly, as I said, would help with the bonuses at the end of the year.
Ding, ding, ding.
And that is all. Any questions?
Yay! Great job!
Thank y'all.